Hello, everyone. It is my pleasure to be with you here today at the 2020 Integrative Medicine Network Forum. And a big thanks to the Osher Center for the invitation to speak with you here today. I've been asked to follow Dean Williams' comments on this morning's topic of resiliency, and specifically to speak on it with the lens of being Dean for Students at Harvard Medical School and how the topic relates to our medical trainees. So I've entitled my comments here, Addressing Wellbeing in the Health Professions, starting at the beginning. As Dean Williams mentioned in her remarks, Dr. Burnout is real, as she points out in the title of her article here. And it is dangerous. As she mentioned, it can really strike at the core of who we are as healthcare practitioners. But in addition, it can affect the reason why we became health practitioners, which is to help others and to provide our patients with the highest quality care. And she described the challenges that healthcare practitioners have had to face in the era of COVID. But the question is, when does this issue of burnout and challenge actually begin? Well, we can see that it starts early, that burnout is prevalent during medical school, and there are estimates that at least half of our medical students may be affected by burnout during their medical education. This sense of burnout can increase during the core clinical rotations, but it truly is present throughout the entire course of their medical education. And this burnout is more prevalent in their age-matched peers who are not in medicine or the health professions. And we know that this is the case throughout training, beyond medical school, into residency, fellowship, and as practicing physicians. The prevalence of depression or depressive symptoms among medical students is high at about 27.2%, according to one meta-analysis. And that of suicidal ideation was 11.1%. So we know that burnout can lead to adverse outcomes as far as our students' mental health and well-being. And once again, to emphasize, this is not just medical students, but this can happen in other health professions as well. So it really is important to note that this burnout can begin early. We need to recognize it and strategize as to how to address it. So 2020 has been an interesting year. We have talked about burnout, we have talked about resiliency, even prior to 2020. But 2020 has brought us the pandemic of COVID-19, which has stretched our healthcare providers, as Dean Williams described, but it has also brought our medical trainees many challenges. Many of our students were pulled from regular clinical duties and left without a clear direction as to how their medical training would proceed. Many are at home, where, as we have witnessed in the media, that we really have seen differences in socioeconomic status among our trainees. The equalizer of being in a dormitory or at school is no longer present, and students may face new challenges by having to learn remotely. And the idea of not having a community as one would in person. But 2020 has brought us more than just COVID-19, as will be discussed later in the conference in the diversity, equity, and inclusion section. We've really seen a dual pandemic. There is the second pandemic that has really been present beyond 2020, but has really been brought to light as that's the pandemic of racism, systemic and institutional racism. And when thinking about this topic, a tweet or a quote, actually, that one of our medical students at Harvard put up on her account and told us verbally is that this is not business as usual for really any of us this year. When it comes to the issues of racism, we have to remember that some students don't have the luxury of ignoring what's on television, what is happening across the country as far as the violence that is taking place and the stories that we've heard of violence. And we need to be cognizant of that, especially as we think of resilience and wellness, that we need to see how our particular populations of students could be affected differently, and think about what we need to do to support them. So once again, to emphasize that pre-2020, we were thinking about things that may result in burnout, things like loneliness or finances, imposter syndrome, work-life balance, family concerns, uncertainty of the future, and mental, physical, and emotional exhaustion. And those seem to have been exacerbated in 2020, and the question mark, what will happen post-2020? But regardless of what happens, there are certain principles that we can adhere to and think about to ensure the well-being of our students. This is very different than the 1960s, when the focus of research was to identify personality traits that were associated with different levels of experience stress, rather than thinking about the student and how to support. It was more thinking about, well, what are the characteristics that would allow someone to persevere through this particular environment. But thankfully, this has changed such that there are now mission statements by organizations such as the American Association of Medical Colleges that supports a culture in academic medicine that values the well-being of faculty, staff, and learners. An environment that prioritizes health professionals' well-being aligns with AAMC mission of improving the health of all. So things have changed from health professions training of earlier days, and that there's been support to do this, but how do we operationalize this, and how do we think about addressing the issue of burnout and well-being in our trainees before they develop to become faculty? Well, we've seen across the country a variety of initiatives, schools really focusing on wellness, well-being of their medical trainees, with the opening of wellness centers or the development of different kinds of programs that will help students face these particular challenges. I wanted to talk a little bit about our approach here at Harvard Medical School over the last few years, in particular in my last 4 years that I've been Dean for Students. Many schools have approached wellness in a variety of ways, but this is our story and our approach. Our wellness program, we think of it in one way, a Venn diagram of 3 different categories of students being well, of students staying well with habits and skills that can be learned and utilized throughout their time here, and the idea of getting help, that at many times all of us will need some kind of assistance, and really stressing the importance of being able to get help to work on one's own well-being, because that will make all of us better healthcare practitioners. We've taken a holistic approach that you see outlined here, where really the very important thing is to establish a culture in the medical school that puts an emphasis on medical student well-being, focusing on the appropriate student support services, access to mental health services, working on issues within the curriculum and offerings within the curriculum that will give students tools to better care for themselves, focusing on the learning environment around them, offering well-being programs, and finally, the importance of really student and faculty partnerships. We can't emphasize enough the importance of really setting a medical school culture that affirms student wellness and the importance of one's own well-being to take care of our patients. And for us, it's being able to express that in a variety of ways that other schools have as well, including having a director of wellness. For us, it's in our academic societies, our learning communities. Ensuring that we highlight mental health and our learning support services at the beginning of every course. So it's something that we talk about, that it's not hidden in that only the weak come for help, but it's really talking about it as much as we can, having not just the wellness director talk about it, but really having all faculty talk about it. We create and advertise safe avenue for feedback to give students that sense of empowerment of their own environment. And that includes feedback on courses up through feedback on mistreatment issues. We give students a voice, really they're on all of our standing committees. And as we'll talk about in a little bit, we embed wellness themes into our curriculum so that way the onus is not on the student to make time, but we feel that it's important enough to put themes into the curriculum itself. And finally, it's addressing the environment that maybe we can't control as well, which is when our students go out to do clinical rotations, to work on our learning environment to make sure that it's a positive learning environment for students. Student support, we want our students to feel that they are here to become physicians, but that we also care about their personal advising as well. So we ensure that the whole student is taken care of through career advising, academic advising, but also personal advising to ensure that our students are transitioning well throughout the variety of milestones in medical school. We develop our faculty, both our advisors and teaching faculty, to recognize the importance of student well-being throughout the trajectory. And finally, ensuring that our students have adequate support services, which will include support for academics, where we have learning specialists that through our Office of Learning Resources and Support, our students can gain access to what they need academically. Mental health services, as I mentioned before, this is something that we talk about even from day one. We have faculty members that during our orientation will talk about their own battles with depression or mental illness. That is something that's not hidden from students, and ensuring that they have access to adequate mental health services throughout their trajectory here that include innovative programming that the university provides, including telehealth support, group support, prior to the era of COVID, drop-in hours where students could speak to a social worker. But again, it's the combination of a culture that normalizes accessing mental health services and having those services available. And the curriculum, and I really wanted to highlight this because I think this is something where this particular group can make incredible contributions. So over the course of the last few years, through the help of Darshan Mehta, who will be on our panel a little bit later, we've designed a curriculum that's been integrated across our first year called Building Resilience, Depth, and Grit in Medicine. And it was designed by Darshan, modeled off some of the principles from the Mass General Hospital Benson Center SMART program. And it has been really incredible to offer students the topics that you see here, where depending on the particular session that we're having throughout the year, students can rotate through a variety of workshops that we see are tools. And again, this is something that's embedded. This is something that's not offered alone, saying these tools alone really will help build your resilience. But it's part of a holistic approach to wellness and well-being that we've tried to take, that this is just one component. But again, I think that this is, in looking at the diversity of topics that are offered here, I think that this is something that will resonate with this particular group, and perhaps a contribution that you could make at your own institutions. In addition to this particular course, we have a course called the Developing Physician that runs during our first 2 years that brings students together in small groups with expert facilitators, really to process things that are going on in school, to process the transition to medical school, or the transition to the wards, or the transition of taking care of challenging patients, and offering students a voice to discuss these challenging topics, and develop reflective practitioners. Again, tools that we hope will be useful for students throughout their careers. We also have extracurricular programming that may seem more like traditional wellness offerings, again, as a component to offer students other experiences that can, again, provide some tools that will allow them to navigate the different challenges that medical school may bring. And finally, I wanted to talk about the faculty-student partnership. So the emphasis here again is that this is really a holistic approach where we are partnering with students, acknowledging that our students are in a system, and that we at the medical school have tried to change our educational system to make it uh, one that really tries to highlight and a student well-being and empower our students. Really, in the same way that Dean Williams talked about changing aspects of our healthcare system to promote the same for physicians. With the faculty-student partnership, for us, this started with our students approaching us to do an in-depth study about wellness and well-being at the medical school about 4 years ago. And this is really where we started to change things, where we realized what we needed to strengthen, the programs that we needed to offer, and the idea of taking a holistic approach to ensure that we were looking not just at specific programs, but the way in which the medical school runs as a system. Our students have incredible ideas. That our philosophy is that we will empower you and we will support you to really put these ideas into place, and we'll take the ideas and really give the resources to be able to implement them. We don't want our students to be responsible for doing that. We feel that that's the responsibility of the medical school. But as all of you know, many times our young people will have these incredible ideas that faculty that are a little bit more removed from the medical school experience may not have thought of. We have our student wellness board, as many other schools have as well, that really inform us as to what we're doing well and what we could be doing to improve even more. So as far as the future, we think it is very bright. Again, the fact that many medical schools are taking a similar approach, I think serves two purposes. Is one, that we're developing leaders of the future that will hopefully value these principles, that a physician who takes care of oneself will take care of their patients even better. And as they move forward, that they will implement and be advocates for, again, the ideas that Dean Williams highlighted in her talk. To change our electronic medical record, or to advocate for chief wellness officers, and that they will be the catalyst to changing our system. And at the same time, it will hopefully provide them with some personal tools and habits of ensuring that they prioritize their own well-being over the course of their training, and hopefully that can rub off on their peers as well, to really create a space where we could, in the future, reduce burnout and improve the well-being of our physicians, which I will have no doubt will have a wonderful impact on our patients as well.